Hello everyone, welcome back to Adventures Through the Mind. I'm your host, as always, James W. Jesso. This is a podcast that explores topics relevant and related to psychedelic culture, medicine, and research, and always with the underlying wondering of how do we work with and through our psychedelic experiences to become better people for ourselves, in our relationships, for people we don't know, and the people who will follow us after we're gone, and in some sense, perhaps even the whole world. And we do so by trying to get as much of an understanding of every different intersecting topic about psychedelics and altered state experiences that we can essentially get our hands on right now. So thank you for tuning in. Welcome. This episode is about hallucinogen perception persisting disorder, and here is the overture. HPPD, hallucinogen perception persisting disorder. As far as much of the modern psychedelic culture is concerned, this is an inconveniently lingering leftover of the early years of psychedelic prohibition, a propaganda tactic used to demonize psychedelics, still haunting us through the prevailing ignorance and cultural stigma against psychedelic use. And in some sense, this is true, and as a consequence, many of us downplay and dismiss HPPD as a legitimate phenomenon, leaning instead towards the assertion that it isn't really a thing, and if it is a thing, it's not all that common, and if it is common, then it's more so about non-drug-induced HPPD and not actually the psychedelics themselves, and I myself am included in that downplaying, unfortunately. However, it turns out that hallucinogen perception persisting disorder is very real, and much more common than the so-called psychedelic renaissance is presently recognizing. This is no surprise to the many people who experience and many who suffer with the symptoms of HPPD and find little to no recognition or support in the larger psychedelic community. People who have, instead, faced that very downplaying and dismissal in the form of the delegitimization of their experiences, sometimes even to the extent of being ostracized. Now, why might this be happening? Well, I don't know, but one thing that we could think about is that in a movement to legitimize psychedelics in the mainstream and urge the vanquishing of ignorance and stigma around them, HPPD is truly an inconvenient phenomenon, as sadly it suggests that some of the reasons for anti-psychedelic sentiment left prevailing since the era of the hippies might be valid after all. But it's here that we find ourselves in a tangled mess, from the use of it in anti-psychedelic rhetoric, to psych-culture's dismissal of its legitimacy as a diagnosis, to the regular mishandling of that diagnosis at the hands of psychiatrists, to the general lack of understanding and representation across psychedelic research as a whole. HPPD is a misunderstood and often mishandled phenomenon. This is why we feature Ed Prideaux on this episode of Adventures Through the Mind. He joins us to talk about what HPPD is, its symptoms, its history, its association with other mental health conditions, how widespread it seems to be, and how it isn't necessarily a negative experience, but often is. We also speak about psychedelic flashbacks, what they are and what they are not, the role of memory, trauma, and neuroplasticity in HPPD, the pathologizing of neurodiversity, and each of our personal experiences of the condition. Ed's bio is coming shortly, but first two things. One of which is a big thanks to the HPPD subreddit. I made a post there asking about what kind of questions might I ask to help the people on the subreddit get a sense of things that they want to know about, or B, have questions that trigger discussion that will inform the larger psychedelic culture to what HPPD is and what it's like to have it. And so many of those questions got addressed throughout the natural course of the interview, and the remainder got explicitly asked at the very end. So thank you so much to the HPPD Reddit community for those questions. The second is that this podcast is brought to you by listeners like you on the basis of generosity and reciprocity. Through voluntary contribution of financial assistance to the show, my patrons on Patreon and other people who leave one-time donations enable me to continue my full-time work of this show and the larger body of work that supports it while earning a living doing so. And I am deeply grateful for that. So thank you very much. Thank you to my patrons, in particular as well, the people whose names are listed on the screen here on YouTube or in the description to this episode, wherever you are checking it out, because those people give significantly. If you are not yet a patron and you're enjoying the show and you're getting value from it and you can't afford to financially contribute, no problem at all. It's free for you to use, and Patreon and the generosity and reciprocity of those who can afford to contribute financially make it so this show stays independent and stays free for you to enjoy. If you are able to afford contributing financially to the show, please do so. I would really appreciate it, and it helps support the show's existence as a free and independent podcast. Not much, really just as much as a single cup of coffee once a month is what I'm asking for, and it really is something that contributes to the overall financial integrity of this full-time work that I do to produce the show. So thank you very much for becoming a patron by heading to patreon.com/James W. Jesso. You could also leave a one-time PayPal or crypto donation. Links are in the description of this in the description of this episode. You could buy something on the shop at jameswjesso.com, or you could check out one of the affiliates that the podcast has a relationship to, also available at jameswjesso.com/support. So thank you so much for supporting the show. And if not this show, another independent podcast, as the sort of larger corporate scene attempts to sort of usurp the podcast space, helping to financially support your favorite independent creators is important. So if it's not me, please have it be somebody else. And so that's all for the intro. Here is my interview with Ed Prideaux on Adventures Through the Mind, episode 152, talking about hallucinogen perception persisting disorder, HPPD. Enjoy. Ed Prideaux is a UK-based writer and journalist who has lived with the symptoms of HPPD since he was a teenager. An enthusiast of psychedelic experience and its clinical promise, Prideaux seeks to bridge HPPD patient groups with the psychedelic community through advocacy for the Perception Restoration Foundation, a 501c3 charity that raises awareness and funds for studies into HPPD and visual snow syndrome. Prideaux has written on psychedelics for the BBC, Vice, and The Independent, and published pieces on music history and psychology for publications like The Guardian, The Spectator, The Quietus, The Financial Times, and others. Ed, welcome to Adventures Through the Mind.
Thank you, James. It's a pleasure to be here.
I really appreciate that you reached out, and it was an interesting timing because shortly after you were like, hey, I'm doing this work on HPPD, and would you like to have me on your show? I was like, oh yeah, that's great. And we had scheduled it was all set up, and it was shortly after that Eric Davis made a tweet about like why isn't the psychedelic community giving more credence to HPPD? Like, we need to be talking about this. And I was like, well, coincidentally enough, this is coming up. So I think it's starting to really open up into the culture and into the research, recognizing that there's something happening here that warrants a legitimate inquiry.
For sure. Although, funnily enough, the coincidence is limited because I actually contacted Eric. Eric is I wouldn't say a colleague, but I've been professionally connected with him for some time, and he's a great source of advice and insight. So I just contacted him to say, hey, Eric, do you know much about HPPD? Do you know anyone with it? Because I'm starting to dive into it a bit more. And then just spontaneously, he tweets that out.
I mean, it's still coincidental in my mind. I was like, oh, this is good timing that it came up in the top of my Twitter feed and all the rest. But it's good to know that we have these connections. So I imagine that anyone listening right now already knows what we mean when we say HPPD, or at least have a sense of the language in some way or another, what it means. But maybe you could start us off with laying the foundation for what is HPPD.
Right. So HPPD it stands for Hallucinogen Persisting Perception Disorder. And it's a DSM-5 listed condition that has basically four key characteristics. One is that it creates certain lingering changes to your perception, although it's also linked to changes in your mood and your thinking process, and also certain somatic sensations. That these changes cause some distress to your quality of life. They can't be attributed easily to other causes. Like, for example, if you have some kind of psychosis spectrum disorder, like schizophrenia, or some kind of maybe perhaps bipolar, which can kind of veer into psychosis on the manic end, and that these changes occurred after the use of a drug within basically a reasonable time frame. And HPPD, it was basically, people have been aware that psychedelic experience in certain contexts can produce lingering perceptual changes, such as, well, I'll run through the basic visual symptoms that people generally experience. The first is, one of the main ones is visual snow, which is essentially when your field of vision is coated with small, granular, grayish, kind of effervescent dots that look a bit like the TV static when your TV isn't properly dialed. And visual snow can really vary in severity. I mean, there's an extent to which everyone has an experience of visual snow if they pay attention. But people with moderate to severe visual snow syndromes will have their entire field of vision noticeably and often distressingly coated with it, to the point where it actually impacts their ability to see properly.
Now, is this in waves or is this constantly?
I think that will vary. So I'll get on to the fact that touches on an interesting subtlety with HPPD, is that there are two types. The first type is HPPD1, which is basically similar to the classic idea of the flashback, when these visual, cognitive, mood, somatic symptoms happen in spontaneously occurring waves that then recede. HPPD2 is when it is a persistent, fixated feature of your perception. Visual, and then to your question, whether visual snow can come in waves or its severity can vary. I mean, undeniably, yeah. I mean, HPPD symptoms are kind of linked to your general level of stress, anxiety, fatigue, whether you've taken a drug, for example, cannabis or caffeine. So these like extraneous influences can change the severity of your symptoms, including the visual snow. I'm not aware of how everyone experiences HPPD, but I'm sure some people, independent of these like extraneous influences, will have their visual snow and other symptoms just waxing and waning throughout the day. But so I'll talk about the other visual symptoms now. So you have visual snow. Another big one is when it's called halos, where essentially objects seem to have a kind of haloing effect, like the ring around angels' heads, like halos. They're kind of these bright aura, like visions that coat and kind of silhouette objects. You have tracers, which is, anyone who's taken psychedelics might have some knowledge of what tracers are, when the kind of faint silhouettes of the object trail the object as it goes in motion. You also have other classic psychedelic style vision changes, like melting walls, or objects seem to move independently in subtle ways. Like, for example, one visual symptom I have noticed in the past is if I, particularly in my bedroom, if I stare at my cupboards, they seem to kind of waft in and out as if they're opening and closing, which is pretty reminiscent of what you might have experienced tripping. Other symptoms, there's something called pareidolia, which is something some people might have experienced in day-to-day life before, which is when you seem to see kind of things that look like faces in objects. So particularly if your vision's sort of blurry, you might see a face appearing. And then on the extreme end, although I don't myself experience this a lot, if at all now, but some people will see geometric effects, similar to the geometric pseudo hallucinations you get on psychedelics, particularly on blank surfaces or on carpets or on rugs. And then on the very extreme end, you'll have people where they have constant strobing in their field of vision, usually in the peripheries, or some people report seeing like entities like snakes in their peripheral vision. So it's really a broad spectrum of visual changes with HPPD. And then as well as the visual component, you get certain somatic sensations that people consistently report. For me, the most common somatic sensation has been the head pressure, which a lot of people report, which is almost a sense that there's a hand pushing out from the inside of your head out towards your face. And it's quite hard to describe, but it feels like your whole head is, just kind of pressurizing. Other people report the sort of body high effects you get on psychedelics, or maybe when people have been meditating, the sort of like prana effect, where the kind of like a kind of electrical sensation can sort of swerve and surge throughout the body. And these tend, in my experience, to go along with the visual components. And then I don't myself experience this, but some people report the cognitive effects where it feels like the whole thinking process is distorted, almost like, especially when reading, for example, people report dyslexic style effects where they can't process the information they're reading. People I've spoken to say that they experience kind of non-linear thought processes, where thoughts seem to go backwards and forwards as they're thinking them. So you really get to the edge of where language can capture subjective experience, especially on the extremes of HPPD. And these symptoms are not always distressing, but when they are distressing and they create real impact to your quality of life, that's when HPPD becomes diagnostic. And that's how they categorize it in the DSM. I suppose that gives a sort of run through for now.
Yeah. Excuse me. It also, the run through it gives is just so wide that it's, and so many of the things that you were mentioning are things that I am identifying with, like that I have the experience of. Like, for example, strobing lights. When I'm going to sleep at night, I will see strobing lights from time to time coming out from the side of my eyes. I was like, I know that's a weird experience. I don't know anyone else has had that experience, but I'd never thought about it as being HPPD. I remember when I was taking quite a bit of acid in my early 20s, I remember one day just realizing that color was all different now. It was like the saturation of color and the differentiation between light and shadow was so different now that I was like, oh, this is like an entirely different way of seeing the world. And it either persisted forever or it slowly waned for so long that I didn't notice it going back. Or if it persisted forever, it's just now my new normal. And a number of other things, like especially watching trees blow in the wind, all of a sudden I'll feel like I'm high on LSD again, or moments of seeing auras and stuff. And what's interesting is hearing that and then thinking about a medical paradigm that would see these things as being distortions of perception, pseudo hallucinations, and then realizing that from a personal standpoint, like having moments where I feel like I'm in an altered state because I'm moved by the beauty of the trees that is akin to LSD. I don't think of this as, I had never thought of it as HPPD. I thought of it as like something like, oh, like I'm more able to access a certain way of perceiving things now, and this is pleasurable, or this is meaningful, or whole cultures of people that are oriented around seeing auras as being like a positive attribute, like a skill, something to celebrate. And even, seeing entities in places. There are whole cultures that are, that train to be able to do this. And so, I'm not sure entirely where the question is here, because it's just like, it seems like what you've described is such a huge sort of like bin of experiences, and that not all of them seem to, that they don't always seem to be negative. And I'm wondering what role sort of like, I'm not sure what my question is here. I think I'm just kind of like, wow, surprised and astounded by what you were just saying. Let's see if there's a question. Actually, I'll just let you respond. Yeah.
Right. So a lot of points there. You're absolutely right that what we call HPPD is a very broad set of symptoms. And something I'd like to emphasize throughout the podcast is that HPPD is really under-researched. So we don't really know how all these symptoms go together and in what ways, and in the ways that should constitute a diagnosis of something. Like, for example, I don't experience the cognitive effects, but I do experience the visual effects. I haven't even mentioned the auditory component. Some people experience auditory changes. Well, I'm not an I haven't read too much on what people's auditory experiences might be, so I won't assume. So I think that the sort of the expansiveness of the symptom range speaks to a lack of research and proper detailed codification on the issue. You mentioned that you'd experienced certain changes yourself, and I think that this isn't unexpected. I mean, I came across a study in my preparation for this podcast that suggested that between 5 and 50% of lifetime users of hallucinogens had experienced some hallucinogenic style effect whilst they were sober. And that's an incredibly wide range. So again, that speaks to a lack of research, but it also suggested that these changes aren't necessarily abnormal. And I mean, in my own personal conversations, I mean, I know several people who have noticed, for example, traces or objects moving independently with an experience of psychedelics, and they attributed that to, oh, that's probably because I tripped in the past. You mentioned that these sort of changes are not necessarily stigmatized or viewed as bad, and they're actually pleasurable for you. Mm-hmm. I think that what's important to emphasize for the outset is that I think that there is a role for this being a real issue when these changes are severe, mm-hmm. and when that severity really starts to overtake people's lives, mm-hmm. To the point where they can't go about their everyday life. Mm-hmm. And that's especially when their experiences with psychedelics weren't necessarily pleasant, and also when these changes were completely unforeseen. So, and that can easily bridge to these experiences being overwhelming, to them being frightening. Because mm-hmm. many people, when they take psychedelics, weren't aware that HPPD was a risk. So I wrote an article for The Independent about HPPD in summer 2020. And for that article, I ran a kind of snap poll of the HPPD subreddit, asking, like, how many of you knew that HPPD was a thing, or that these kind of changes were possible before you took a psychedelic? And the majority either had no idea what it was, or what it was beyond maybe a sentence of reading. So essentially no in-depth knowledge. And so when they, especially perhaps the next day or within a few days or within a week of taking the psychedelic, they start noticing these things, it can be immediately frightening. But you're right that these changes aren't necessarily unpleasant or distressing. In my own personal experience, when I first started noticing them, they were a source of occasional stress. Mm-hmm. I mean, I remember a particular example of when I was, I suppose this will be a bridge to me kind of explaining my experience of the condition, where, I remember when I was sat in my living room, and this was a living room in which I'd taken and had basically pretty pleasant experiences with LSD, looking at the same wallpaper that I'd seen melting on, whilst listening to the Beatles and stuff, and had amazing times. Yeah. And then just looking at that, wallpaper and noticing it was still melting, and just noticing this real sudden sort of onset of panic, just thinking, what the fuck have I done to my brain? Mm-hmm. That was the sense that I got. And I think that this isn't necessarily helped when these changes are viewed as a pathology. Mm-hmm. When these changes are viewed as a distortion, a damage to your brain. But I think that there's room for a diagnostic framework when these changes impact quality of life. And I think that if you return to the kind of roots of what constitutes mental illness or disorder, it is when these symptoms impact quality of life. And there are many hundreds of people, thousands, that's another problem with HPPD. We don't know how many people actually experience these changes in persistent ways, but many people report that these symptoms are very distressing. I don't want to be sensationalist at all, but from my conversations, and I don't know personally who these people were, but I have heard of people, unfortunately and very sadly, claiming their own lives because these symptoms were so distressing. And these have to be situated in context. For example, they may have had other stresses in their life. Perhaps the coping mechanisms they used for their distress perhaps weren't always useful. I mean, I know that alcoholism and drug dependence are issues for people with these symptoms. Perhaps their psychedelic experience that led to them was in itself traumatic, and that can independently provide the sort of mental stress that might lead to a terrible event like suicide. But there is a link, and I think I just consider myself blessed that these haven't been real sources of distress for me. But I think a problem is that a lot of people in the HPPD community develop these symptoms whilst they were young. So many people online, especially, that they'll gather onto the HPPD subreddit. They'll go onto hppdonline.com. Just these confused, distressed, anxiety-ridden, terrified teenagers wondering what they'd done. Only last week, they were having a great time experimenting with magic mushrooms or LSD, MDMA, sometimes cannabis with their friends. And then they notice something's happened. They can't tell their parents because they don't want to tell them they were doing drugs anyway. They don't want to freak their parents out. Perhaps their experiences with psychedelics were really positive, and there is a certain level of distress that comes along with the sense that maybe I'll never be able to experience psychedelics again. I don't want to damage my brain again. So you have a lot of people in the community saying, will I ever be able to trip again? Because psychedelics can provide very meaningful experiences, as you well know. And so the sense that you can't join in the fun anymore it creates almost a sense of mourning. But to return to the sort of teenage cohort, they can't tell their teachers at school, they can't tell the counselors because maybe they'll be expelled for having done drugs. So these kind of things. So it's all in context. Sorry, do you want to go on?
Yeah, I want to jump in because I feel like you're saying you're speaking to a lot of really important things there, and I want to first say express gratitude for you pointing that out. I know when I was speaking of my personal experience, it would sound as though I was minimizing or marginalizing the negative effects that it could have, and that was not my intention. I'm glad that you spoke to that because I do understand that people who have suffered from it suffer greatly when it's distressing, and I can completely appreciate why that would be the case. I have suffered from distressing experiences through psychedelics and their consequences afterwards, not necessarily the HPPD like symptoms I just discussed, but absolutely. And what you're speaking to with regards to like education and knowledge, information, both in the person, in the culture, and in the institution, I think is incredibly valid because perhaps there's, especially with stigma, if you have this teenager who has this thing, doesn't know what's going to happen, but they can't even speak to anyone about it. This speaks to, I believe it speaks to like a deep sort of, a deep problem we have around these drugs in our society, which is, I mean, I'm not like breaking new ground here by suggesting that the sort of current stigma that we have around psychedelic drugs is actually more harmful than the drugs themselves. But like hearing this and thinking about how that's going to impact younger people and thinking about from myself, my ignorance when people would ask me about HPPD and I'd say like, yeah, it's a thing, but from what I understand, it's very rare. And increasingly I'm getting the sense like, no, it actually isn't very rare. And this is a very important thing to be discussing so that, the work here I do on the podcast is very much trying to create sort of content reference points to inform the larger discourse that is unfolding around psychedelics in psychedelic culture. And in particular to sort of help sort of weave certain things in so that people don't have to find the podcast. There's just enough people who have already been talking about it that they have good information available to them as a consequence of these sort of like these conversational artifacts that get put out as content on the internet. And so I'm feeling really grateful for this conversation as it's unfolding now. And I want to ask a question about, I think in the sort of preamble we were chatting, I had mentioned something about the DSM and the pathologizing of reality, especially the DSM-5, was sort of widely rebuked as being like, okay, so now everything's a disorder. Everything's a disorder that requires, being drugged. And there's not just what you were saying about like, oh, I can't say to my teachers because they don't understand. But if you speak to a doctor about it, instead of somebody sitting down and sort of helping to normalize your experience, help you feel more comfortable, like there's a movement of people who hear voices to be like, well, instead of trying to make those voices go away, you try to develop positive relationships with them, right? Something like that, positive relationship to the experience. That the idea that, you're experiencing something that is perhaps actually a very normal consequence of taking psychedelics that could be received as positive and developmental in a certain context, assuming it's not too extreme, or might need some sort of support in order to orient around it. But instead you're being told that, you have hallucinogen perception persisting disorder. Your brain is disordered now. You broke yourself. And what that does to a person, and now trying to, live with perhaps this thing now for the rest of their life. And again, I'm not sure where the question is here, but I'm just feeling really sort of like checked and positive in this conversation.
Awesome. Yeah, I really appreciate you being sensitive to the minimization issue. Just because there is a somewhat toxic tendency among the kind of fringes of the psychedelic community, so to speak, to minimize the condition. And especially among people who aren't educated on the topic, that they'll say, it's all in your head. It's because you didn't test your drugs, bro. You just, you name it.
Well, just to quickly jump in, even in the larger research field, I think there's like a real sort of like trying to wash the larger research and industry field, trying to wash the consequences of psychedelics and be like, yeah, they're really positive as long as you do it through the exact channels that we're setting up for you to pay for, and not wanting to speak to the gritty, messy mystery of the whole thing.
Right, exactly. The issue of whether the current for-profit clinical psychedelic sector has certain incentives that lead them away from digging into these things is something I want to talk about later. But for now, I'll address the sort of DSM-5 pathologizing culture issue, which is a very important one. So I guess to start, awareness of what HPPD seems to be very low amongst most psychiatrists, clinical psychologists, therapists, counselors. And so from the outset, there is a risk of misdiagnosis if you start heading into these channels, if you're distressed by your condition. So I'll share my own personal experience. So something I actually didn't mention at the beginning was that HPPD has very strong comorbidities, which means there are psychological conditions that often go alongside them, and they kind of feed into each other and synergize with them. And as well as anxiety and depression and suicidal thoughts, a strong comorbid illness with HPPD, or although I kind of resent using this kind of like diagnostic pathological language, but here we go, is depersonalization derealization disorder, which for listeners that aren't aware is a strange condition in which, so the depersonalization aspect, you feel like you're separate from your body. You feel like you're looking out of the world, like you're looking through a camera. You feel like you're a robot looking down at yourself. You aren't your own body. You feel depersonalized. And derealization, which a lot of the time goes along with the depersonalization, is a strange intuitive sense that the world around you doesn't feel real. So my HPPD has gone along with cyclical variations in DPDR, as I'll call it from now on, since I had the condition. And it's definitely related to stress. And there was a particular experience I had when I was 21, when, having lived with HPPD for 4 years, I was now approaching graduation from university or college. I was interviewing for jobs. I was stressed generally. And this triggered essentially a few days of quite serious DPDR when, as I just described, the world stopped feeling real. My HPPD symptoms were ramped all the way up, where I remember going into a job interview once and I had basically a full-blown, like, and I don't want to use this word, but I basically had a full-blown flashback during a job interview, where, you know, the boss interviewing me, their entire face was coated with like neon psychedelic colors. I felt depersonalized, lightning bolts in the room, rainbow flashing colors. And I'm a pretty resilient guy, so I was able to kind of just play it cool, and able to answer the question correctly somehow. But it was still pretty freaky. And I remember walking afterwards outside, listening to Strawberry Fields Forever, where it has the famous lyric, "Nothing is real." And I started thinking, you know, fuck, maybe John Lennon was onto something. Nothing is real. And I had this derealizing effect. Nothing felt real. And this came along with a particular anxiety attack one evening when I had to write down my own name repeatedly in order to kind of ground myself in my own identity. So this was a very scary period for me. And for about a year after that, I couldn't really process what the fuck had happened. And I went to a counselor to try and make sense of it. And as I just alluded to before, she had never heard of HPPD. She had no acquaintance at all with psychedelics. She had never heard of depersonalization. She'd never heard of derealization. So that's a real issue for people seeking help, is that there's this chronic problem of low awareness. And this feeds into misdiagnosis, especially if you go and see a psychiatrist. So I've heard lots of stories of people who have gone along to a psychiatrist, reported that they've continued having visual distortions, so to speak, after taking LSD or mushrooms. And the doctor has said, okay, that's classic drug-induced psychosis. Or they'll say, okay, sorry, sir, but you are exhibiting the symptoms of schizophrenia. And I think this was more of an issue in the 80s, 70s, leading on to the 90s than now. But there will have been lots of cases of people who have been misdiagnosed as paranoid schizophrenic, maybe institutionalized, heavily medicated with side effect-laden antipsychotic drugs. And it's a real problem. And one more fact in this respect is that, you know, the tentative work by Dr. Henry Abraham, who was kind of the first person to codify and capture HPPD as a condition. And his observational report suggested that the average patient he saw had to go and visit 5 different specialists before anyone had any idea really what was going on, and maybe described it as HPPD. So they might have gone to ophthalmologists, they might have gone to different psychiatrists who have misdiagnosed them, and then finally they find someone who understands what's happening to them. But then, with this problem of low awareness, on the one hand, there is the problem that the psychiatric kind of counseling superstructure, if you will, does tend to pathologize neurodiverse experiences, such as seeing certain visual changes as being necessarily a pathology. And I think that's a problem, because it feeds into the very anxiety that defines HPPD and makes it a demanding issue. One of the best, and just speaking to any HPPD patients listening to the podcast, the best thing for me in reducing any distress I've ever experienced has been just, you have to accept. Like, there aren't good treatments now. We know very little of the kind of particular pharmacological treatments that might help. Meditation can help. Just lower your level of general anxiety. Accept. Maybe there'll be treatments in the future that can just wipe out these visual changes, but till then you have to accept. And I think that the tendency to pathologize, view your condition as brain damage, that you've broken your brain, as precisely as you said, it raises the anxiety that leverages your symptoms even further. And I think that the problem of pathologizing neurodiversity is an urgent one. And I wouldn't say I'm necessarily an expert to speak on it, but I think that just what I'd like to emphasize is that these visual changes, they can be accepted, but they still provide a kind of independent level of anxiety to people, and they'd rather they weren't there. Many people would just want to be how they were before, that they want to be able to look at a night sky and not have it coated with TV static. They want to be able to look at a painting and not have it morph and bend. I mean, I remember thinking when I was 17 that, fuck, will I even be able to look at my grandkids' faces and not have them slightly move? Will I be able to, drive? This was a concern for a period. Will I be able to drive down the road and be able to see road signs? So these kind of things can be accepted, but it's important to emphasize that these changes, they can provide, as I've said, an independent layer of distress that I think needs addressing.
Mm-hmm. Yes, definitely. And one of the things I was thinking about while you're talking was like what your experience would have been like if you were able to speak to somebody who was aware of this kind of condition, who their profession is in understanding and integrating a psychedelic experience, and you'd be able to talk to them and have somebody who who you can feel safe to just talk to, who's informed and who can compassionately hold space for you for the distress, while also helping you make meaning out of your experience in a way that leads to even something you're experiencing as negative, at least being something that you can engage in a positive way rather than spiraling out. When you were talking about DPDR, some of those experiences, I mean, minus the one of like seeing the person, like you had said, like the classic acid flashback idea, depersonalization, derealization, in some sense, if you look to different religious texts and cultures, the idea that nothing is actually real is sort of foundational ontology for a lot of different religious and spiritual traditions. And having someone be like, yep, that could be the case. And lots of people experience that. And also, like, here's how you can continue to live your life knowing that regardless of how unreal it might be, it's the realest thing any of us will ever know is to, be alive as this person or something like that. And the possible association between the distress of those experiences creating dissociative states, which you are now experiencing subjectively as an increase in the presence or the intensity of those flashbacks or HPPD symptoms, and just having somebody else there, informed, compassionate, and again, this speaks to what we've been speaking to throughout the last several minutes about the lack of information, and how negative bad care can be on somebody who's just could be going through just something that's kind of tough and scary, and especially someone who's going through something that is life altering in a fundamentally, disparaging and threatening way. Yeah, go ahead.
Yeah, I mean, I completely agree. I think that all that you've said, I think it speaks to the urgency of whatever HPPD is, whatever this set of symptoms is, because we're seeing more and more people taking psychedelics outside of in adult use settings. I think I saw statistics from. Well, I think they were released last month that suggested that the use of psychedelics amongst college-age US
have increased during the pandemic. Yeah.
Right.
Yeah.
I think it's higher since 1982, and now 1/5 of American college-age individuals have tried psychedelics. And then in these adult use kind of non-clinical settings, I think that your ability to properly integrate will be really constrained, because there's just, our whole caring profession, psychologists, psychotherapeutics, psychiatric infrastructure, it just doesn't really know what it's talking about when it comes to psychedelics, at least from the reports I hear. And I think that as you have this trend of increasing adult use and maybe an unprepared infrastructure to kind of contain and help integrate these experiences, I think that there is a kind of gap left in which the distress that these changes can cause will only be left to fester. And the lack of integration, I think, personally, definitely increased whatever distress I've experienced through my HPPD. Especially because, as I mentioned earlier, like these are just, a lot of these guys are just teenagers taking psychedelics. And me, I was a 17-year-old who thought, and my idea about psychedelics was that you have to increase your dose every time you do it, because the more you do, the better. Mm-hmm. And so by my fourth trip, within 3 months. I was taking 200 micrograms, and I'd only tripped the weekend before. So this is another problem of teenagers, is that they're kind of fucking idiots. They think they know what they're doing, and they really don't.
Well, I think there's something explicitly about that time in their brain development that they're not very good at being able to track consequences, risk consequences in their decisions.
No, yeah. So I was not prepared for the 200 microgram experience, and it was a pretty challenging, unpleasant trip. And I think that the unpleasantness, I mean, the research suggests that HPPD symptoms or HPPD changes, especially when they cause distress, are more likely when you've had a traumatic or anxiety and panic laden experience. And for me, that was a pretty unpleasant experience. So you have adult use as a whole increasing, especially amongst young people with developing brains and evidence suggests, although very tentatively, that these changes are more likely with the developing brain, where your neurons are still kind of in this flux state, they haven't properly set. I think that one real way to kind of make sure that these changes don't become distressing is it has to be structural, it has to be systemic. There needs to be more psychedelic integration therapists. There needs to be more awareness amongst counselors that, there's this psychedelic tsunami happening right now. It seems to be pointing in one direction, and you're going to have more people coming to you for help. In the UK, where I'm based, I'd say there are probably maybe 5 specialist psychedelic therapists. You're going to have, and I think that you're going to have thousands of people turning on psychedelics every year, some portion of whom will want to try and integrate. I think that more than ever, integration is being emphasized, although I think still not enough. So HPPD, it's not just going to be an issue of, let's find the perfect pharmacological treatment. You'll take this pill.
That's never really the great solution anyways, despite the medical pharma infrastructure continuing to press that is the way forward.
Right. Yeah. It has to be structural. I mean, I think that this is a point that's been made before by others, but I think that to really contain the psychedelic experience and its possible weirdnesses, like these changes, we need to psychedelicize psychology. And I think there's a room for pharmacological treatment, because at the moment, so kind of to describe the general landscape for pharmacology with HPPD, all sorts of stuff has been tried. Antidepressants, anticonvulsants, benzodiazepines, and a lot of these treatments have proven useful for people, basically in lowering the anxiety of the experience, and that, as well as reducing the distress, it reduces the intensity of the visual changes. And this tentative evidence suggests that these might be useful, but these are just handfuls of case reports. Maybe you have a write up of giving it to, I don't know, 2, 3, 4, 5 people. Let's try this. We don't really know what's going on. 2/3 of them say it's better, but we don't know if that's placebo. We don't know if it's spontaneously remitted. We don't know how it hold up in controlled settings. So it's complex responding to HPPD, and I totally agree that it will take a kind of multiplicity of perspectives. And I'm interested in the shamanic response to this. I'm interested in the spiritual response to HPPD, and I think that this just speaks to there needs to be research. Some people respond better to some things than others. Other people respond better to other things, etc.
I want to go back and ask you about flashbacks, and a question about sort of the drug-induced element of HPPD. But I want to make like a quick comment, which you could please respond to, which was that when I was doing the research for this episode, I was reading one post from somebody who had said that they had these symptoms and they went to their psychiatrist or doctor, and the doctor basically said, you have to take this drug called I didn't write down the actual name. The brand name was Abilify, Abilify. And they were like, if you don't do this, you need to take this because you're going to develop schizophrenia if you don't. That like that having happened meant that they were going in the trajectory towards schizophrenia and they needed to take this drug in order to prevent it from becoming full blown. And of course, this person was like, this doesn't feel right, like on the forum. I mean, like, can anyone offer me perspective? And so I think even like just that one case study, which I found very quickly, exemplifies exactly what you're speaking about here. And I imagine there are thousands of other sort of anecdotes of similar encounters with the medical model.
Yeah. Fuck, man. I think Abilify, is that an antipsychotic? Either way, antipsychotics, they're scary stuff. And I think that the whole HPPD issue, it speaks not only to the specific lack of research about that condition.
Hello, you there?
Sorry, did I cut out?
No, you're good.
Hello.
You're good.
So HPPD, as well as specifically being under research, it speaks to just how little we know about psychiatric medication in general. I mean, I think that in 20, 30, 40 years, we'll look back at our current suite of psychiatric tools and we'll think, these were just very blunt. I mean, the data around antipsychotic side effects is very frightening. I mean, if I recall, people on antipsychotics on average live about a decade shorter, people who aren't, because it does real damage to heart tissue. If I recall, it can shrink certain portions of brain matter. So it's scary. And I'm not surprised about this guy whose doctor insisted he take Abilify. I mean, and I'm sure it's typical of a certain portion of people. The flashback issue. Yeah. So
wait, before you speak to it, let me introduce the question about the flashbacks.
Right.
Because flashback as a term, from when I was looking into the history of the diagnosis of HPPD, it was like flashback was sort of like the sort of quick term to describe HPPD. Flashback, HPPD were the same thing. And I know that in psychedelic culture right now and in the research, there's a complex relationship to that terminology because of how it has been represented hasn't really been accurate. And like terms like bad trip, I think there's sort of a press back to be like, oh, like flashback isn't a thing. It's just like leftovers from the ignorance of the drug war propaganda against psychedelics, and stuff like this. And I'm wondering if you can comment there about flashbacks, and in particular, if you could weave in, as you're talking about psychedelic flashbacks, what they are, what they're not, how they relate to HPPD, is whether or not, it needs to be a psychedelic, such as could it be cannabis, which I mean might be counted as a psychedelic actually, especially depending on high doses, and whether or not it needs to be drug induced at all. Because I know one thing that's going around now in the culture is like, yeah, HPPD is a thing, but it mostly happens. There's a vast amount of people who get it not associated to drugs. And so we shouldn't attribute psychedelics to HPPD, like we got to keep this perspective. We got to keep the brand clean here or something like that. There's a lot to speak to there. But that's sort of flashbacks and whether or not drugs need to be involved.
Right. Yeah. The flashback issue, the thing is, most people not in the community, so to speak, don't know what psychedelics really are about. But I'd venture that everyone, my family and teachers at school included, had heard of flashbacks before. So it kind of speaks to just how much that term and it's kind of associated, and it is basically a propaganda term, has penetrated how people perceive psychedelics. But for what it's worth, I was reading about the flashback. I was reading about the history of the kind of flashback literature before this podcast. It seems to begin with a particular paper by this guy Horowitz in '69. So this is a couple of years after the Summer of Love. LSD use was declining, and you're starting to see, and obviously there was the existing turning tide about how clinicians thought about psychedelics. Obviously they were initially perceived by many as being very promising, captured by the counterculture, more uncontrolled settings. You start seeing people freaking out. Mm-hmm. And Horowitz, I believe, based his writing on people who had gone to the Haight-Ashbury Free Clinic. So this was a community-run health clinic in the Haight-Ashbury district in San Francisco, which was the epicenter of the psychedelic revolution.
Totally, like hippie central. Yeah.
And I believe that they had, if I recall, by 1969, around about 50,000 people come in through various different things, and a lot of people coming in having panic reaction to psychedelics, a lot of people with STDs, STIs, people with heroin addiction, methadone addiction, etc. But some portion of the people who had experimented with psychedelics, when interviewed by Horowitz, reported that they'd noticed certain, let's say, I think that the phrase he uses is spontaneously occurring phenomena. And so Horowitz and this other guy, Schick, the following year, they were the two main, the two first scientists to document the phenomenon. But I'll start with Horowitz. So Horowitz's paper, it describes a number of case studies through the Haight-Ashbury Free Clinic, and it's like clearly colored by a negative lens on psychedelics. It's very, I mean, it's just perfect for like journalistic copy at the time. So one case study he describes is this 17-year-old who he seems to have been a pretty eccentric character, because he was like, Horowitz describes him singing a song of LSD and speed are for me, like just singing this song. Anyway, this guy taken a lot of trips, and he has started noticing quite vivid pseudo hallucinations of scorpions overrunning his body. Another guy, which I believe this is a woman, was having intense sort of prophetic visions of her getting into car crashes. And Horowitz described, so it's very wide ranging, the flashback phenomenon. And then you see Schick come in the following year, and he codified 3 different kinds of flashback. You had the perceptual flashback, which was it could include very vivid things like the scorpion guy or the car crash woman, or it could have been, spontaneously occurring geometric phenomena. I didn't see much HPPD style stuff like visual snow in these papers. But anyway, so you have the perceptual flashback, you have the mood flashback. So I heard, so Schick writes about someone who would just have spontaneous onsets of depressive mood, which she attributed to a particular LSD trip. And he had somatic flashbacks. So from the outset, it was a very broad phenomenon. But it's the kind of the conceptual core of it was the idea of the spontaneous occurrence. And then flashbacks, as you say, they were captured by a certain wing of the drug warrior anti-psychedelic wing. And I was just reading before this about the Narconon program, which is run by the Church of Scientology. Oh, wow. And for what it's worth, they've captured a lot of, if you look up drug risk online, Narconon appears all the time. I mean, in the UK, where the Church of Scientology isn't prominent at all, you see their pamphlets being given out, I believe, to schools. And they related flashbacks to L. Ron Hubbard's New Life detoxification program, where you could clean all the drugs out of your system, you could clean it all out of your spine. Because that was a kind of parallel.
LSD was in your spinal cord and it was like releasing back into your brain. Yeah.
Right. I was just at a drinks the other day and talking to a friend of mine who was at school in the early 2000s, and he was saying how in his drug education classes, they were still parroting this bullshit that LSD accumulates in your spine, and if you click it in the wrong way, you're going to have a flashback. So it's obviously bullshit, but that end of it. But flashbacks, so as I say, from the outset, a very broad, fuzzy phenomenon, and it seems that the emphasis in the clinical literature is to move away from that term, because if only because it's so toxic and it's been so weaponized. But that said, I was describing at the start of the podcast that there are 2 types of HPPD. You have the type 1, which is like the flashback, the spontaneous occurrence. But interestingly, in the literature, there's a tendency to describe the type 1 flashback phenomenon as being positive, which it seems to be a lot of the time, but then other people find their spontaneous flashbacks actually quite distressing. So maybe that's another room for kind of for evolution in the literature. And whether HPPD really whether it really is the same thing, these two types, I'm not sure, because there seems to be quite a strong difference between it being a kind of an invested feature of your whole way of experiencing the world versus just spontaneously happening. But I think that's just why we need more research, because, I mean, speaking as someone who has read the literature but is still not a scientist, I have no idea what is going on when you have a spontaneous re-experiencing. But that said, you mentioned another question you put in there was, what's the link to psychedelics? You're absolutely right that HPPD is an unfortunately named disorder, because there is no sole link between these changes and psychedelics. I mean, psychedelics in of themselves are such a broad set of drugs. I mean, you have LSD, you have ibogaine, you have DMT, you have psilocybin. I mean, LSD is serotonergic and dopaminergic. Psilocybin, I believe, is just serotonergic, but both can create these changes. Salvia can create these changes. Just cannabis, I mean, but cannabis is hitting cannabinoid receptors. Maybe others. I'm not an expert.
I think it has impact on dopamine receptors too, but I'm not up on the neuropharmacology of cannabis.
Interesting. Okay. But yeah, so all sorts of drugs can trigger these changes. I mean, even SSRI antidepressants have been linked to these perceptual changes. So what does all this suggest? It suggests, on the one hand, that this is like clearly a very complicated phenomenon at the level of like neurophysiology that I'm not really an expert to address, but I can maybe outline. So like the original hypothesis by Dr. Henry Abraham, who is the psychiatrist who first codified the condition of HPPD, is that psychedelics caused a surge of electrical current in the brain that damaged certain neurons that kind of control how the brain filters out visual information. And he links it to the serotonergic system. But as I just said, like non-serotonergic drugs, non-serotonergic recreational drugs can create these changes. And the fact that SSRIs can as well. But even people have had experiences where taking antipsychotics can trigger them. So a potential treatment for HPPD can create the changes themselves independently. I've read reports of people taking certain classes of antibiotics and then having these changes. So there's no definitive link to just psychedelics.
Sure. And from what I understand, there are also people who just have extreme experiences that have nothing to do with any kind of drug and end up having these changes too. Is that correct?
Right. Yeah. So this is something that's been emphasized by Dr. Terry Krebs, who is a really valuable voice on this issue, which is that people experience exactly the same kind of visual phenomena. The visual snow, the halos, the auras, the traces, with just anxiety. And from the very limited reading I've done, this might make sense, even on a neurophysiological level, because anxiety is associated with lower levels of GABA, and GABA is what is being released to kind of inhibit. So if you have less. So I might be getting a little confused on neurophysiology, but less GABA ties into the theory that Abraham had outlined about kind of neuronal damage. And then at the same time, more anxiety is associated with more fixation on symptoms. So maybe this isn't a matter of neurophysiology at all. Maybe it's an issue of people in more anxious states fixating on certain symptoms that maybe are fairly normal, but then within the anxious, elevated state, they're all intensified. We just don't really know. But psychedelics specifically, I mean, it's undeniable that despite the fact that there's a wide-ranging pharmacology or indeed non-pharmacological influences that create these symptoms, psychedelics do play a role. I mean, like sometimes very quickly. I mean, I first started noticing changes the next day. Some people within a week, some people within a few days. But then at the same time, there's so much vagueness in the literature. Some people are diagnosed with having had HPPD 20 years later, which doesn't make too much sense to me. But that said, psychedelics just maybe not. Psychedelics are associated in some kind of special way. It seems there's something about the way they work that creates them more. I mean, LSD by far is associated with HPPD more than any other drug. So whilst cannabis can cause it, whilst MDMA can cause them, LSD seems to be, above all the others, the one most likely to trigger them. I mean, from my personal perspective, I think that this is a very complicated condition, which just speaks to how little we know about how the brain works. And I think that drugs are likely some kind of just catalyst. They're a kind of psychoaccelerant that can create changes that the brain, that the kind of the brain and the visual cortex are already capable of producing, and there might be a kind of looping feedback. There might be a feedback loop with anxiety, but we just don't know. Yeah.
There might be something there too about neuroplasticity as well. You know, like that these changes persist for so long because, you know, your brain just like rewired itself, lack of better terminology, in order to set these perceptual changes as like a new foundation or something. Total hypothesis, like just going off. I don't have necessarily a lot of basis to make that claim, but there might be something there too. And what I'm hearing is you saying something like there's likely some underlying neurophysiological something happening here that isn't necessarily tied to psychedelics themselves and doesn't necessarily need psychedelics to have happen, and that the role psychedelics play in the development of these symptoms or the initiation of these symptoms is significant enough and prevalent enough and sort of like, you know, fairly reliable enough that the role psychedelics, especially LSD, is playing in the development of these symptoms should not be minimized. Is that kind of, have I got you there?
That's absolutely right. Yeah. I think that there's certainly likely to be some underlying neurophysiology here, perhaps related to genetics. So that's kind of one thing that the nonprofit I'm involved in, the Perception Restoration Foundation, has plans to conduct or finance research into is, you know, is there a particular set of genes that are associated with a tendency to produce these symptoms if you have a catalyst like the psychedelic experience or another kind of drug experience. And I think that, yeah, the psychedelics, whilst they're not the exclusive catalyst for these experiences, I think that it's plausible that they are, as you say, a very powerful candidate, especially because psychedelics, I think that they can be, I think that psychedelics, they have an interesting relationship with trauma. And I think that people may have been traumatized by psychedelic experiences in ways they didn't necessarily realize. And by trauma, I mean the overwhelm of the nervous system in a way that it's unable to process at the time.
Right.
And from my understanding of trauma, that I'm obviously not an expert, is that trauma doesn't necessarily have to feel like, you know, the classic vision of the PTSD afflicted veteran. It doesn't have to be dysphoric. It could be the precise lack of intense feeling, because that's part of trauma, is this kind of numbing effect. So I think that in my own experience, reflecting on the particular psychedelic experience that left me with these changes, I think that it probably was traumatic, especially because it was unintegrated, because there was stress afterwards anyway. You know, my parents caught me on that trip. So it was rough. And I think that for sure there was some kind of traumatic heightening of anxiety that triggered something. And I think that we just need to have more research, especially because, you know, Well, psychedelics. I just want to emphasize, because I'm as something of a spokesperson for the HPPD community here, and I am conscious that I don't want to minimize their experience of this was definitely psychedelics. People don't believe me. This happened after this drug trip, for sure. Psychedelics can cause these changes, and we just need more research to complicate and better make sense of what's going on. I think that's just what I'd like to emphasize.
Mm-hmm. Yeah. When you started bringing up trauma, I mean, one of the sort of founders, I think, of the very diagnosis itself, let alone the field of study, Bessel van der Kolk, he speaks of trauma or PTSD as being sort of a disorder of the memory. And that I think that increasingly with psychedelics and the potential of psychedelic therapies to heal trauma, but also other disorders, and how that's linking into increasingly getting a sense of how much early life experiences can inform our perceptions and conduct as adults that lead to paths that bring us into depression and other symptoms. That there's something that we probably don't yet properly understand about the link between past experiences and memory and present perception. And one of the symptoms of PTSD is explicitly what they call flashbacks, where you have the intrusion of the traumatic experience into your present perception, usually as a consequence of it not being integrated. There's something there about it not having in your mind, in your memory, a specific time and place. And so anything can trigger its arising, and the memory is experienced as here and now rather than then and there. And that sort of informs perception in the moment, anxiety, so on and so forth, remembered in the body, linked in the mind, or possibly not linked in the mind. And so when you were speaking about flashbacks, when I was making my notes, I was like, oh, that's interesting to tie in. And I also don't see, linking the flashbacks as a phenomenon that associated to the memory disorder of PTSD that arises as a consequence of extremely distressing experiences should in any way minimize the similar type occurrences happening after psychedelics as experiences HPPD. If anything, it should amplify our sense of like, oh, actually there's something really important going on here if we can have if there are similar consequences. It's not like we could just get to the place of like, oh, it's just PTSD, as if just PTSD is just an anything,
Mm-hmm. Yeah, really interesting. Before I address that, I wanted to just put out some information because I'm kind of deep into the literature. And so I just remembered that on the kind of question of an underlying neurophysiology, to any HPPD listeners out there or people considering taking psychedelics, there is tentative evidence to suggest that basically people who already had some experience of visual weirdnesses before they tripped seem to be much more likely to develop the condition. And this is based on the work of John Halpern and Torsten Passy from a few years ago. And so in my own experience, I definitely noticed when I was 13, 12, that at night I could see purple flashes in dark environments. So definitely there might be some underlying neurophysiology at play. But onto this question. Yes, the role of memory. This is something I was reading about before the podcast. So HPPD, particularly the more florid pseudo hallucinations that go along with HPPD, they seem to arise on blank surfaces or in dark environments where basically there's more flexibility for the brain to work its magic in activating memory. So there is a definite role of kind of visual memory, how the brain will fill in the blanks with its own kind of storehouse of experiences and imageries. And I came across a paper which suggested that, although this paper I think it should be taken with a pinch of salt, if I recall, its sample size is pretty small, which is that as many as, I believe, 2/3 of people with schizophrenia, although HPPD is not schizophrenia, got to note that, 2/3 of people with schizophrenia, they report many of their hallucinations being tied to specific memories, to specific events. And I think that this also is tied to the fact that it's tied to how close or you are to particular triggers or stimuli related to the drug experience that cause these changes. Like, so at the start of the podcast, I was describing how the wall that I used to trip out to, that would melt in a special way. Absolutely. That wall, something special about it, man.
Yeah.
It melts like nobody's business when I look at it. PTSD, from my reading, it's already independently associated with visual changes, blurry vision, tunnel vision, which is also something that people with anxiety experience. So basically, I think HPPD is not only a demanding source of distress that needs to be addressed, but it's also, I think it points to quite fascinating unanswered questions in how the brain works. Like the link between emotion, memory, and the emotion, memory, the visual cortex, cognition. I think that it's a microcosm of mysteries that need that people should be fascinated to research anyway. Mm-hmm. And I'm reminded you were talking before about the issue of neuroplasticity, and another thing I wanted to mention was there's a particular hypothesis that's been shared by Scott Alexander behind the Slate Star Codex blog, which some listeners might be aware of, which kind of attempts to relate HPPD to the kind of Bayesian brain hypothesis, that there are certain like kind of categories, ways of doing things that the brain brings into all its perception and cognition. And when you have a particularly elevated experience like the psychedelic experience, these assumptions, these categories are relaxed. And then the idea is that with HPPD, these assumptions aren't put together in the same way again like they were before the experience. So there's a metaphor by a think tank that I'm a fan of called the Qualia Research Institute, mm-hmm. which describes it like expanding and contracting metal. So you have something very affecting, like a psychedelic experience, which expands and dissipates your visual and perceptual and cognitive assumptions, and then it's not pieced back together again in the right way. I think that speaks to,
or at least the same way.
At least in the same way, yeah. Right? Yes, that's an important qualification to make, and I think that speaks to perhaps, and I think there'll be a great study in assessing whether having strong integration and aftercare makes developing these changes much less likely. And that seems to be the case because in the clinical trials in psychedelics, which obviously have a lot of integration, preparation, aftercare, you don't see it come up. So this isn't just like basic functions of brain current and damage to interneurons. This is a very complicated, holistic condition. But I think that, most people don't take psychedelics in the context of clinical trials. They're taking it at festivals and parties in their own homes. And when you have that, people not necessarily being aware this might be a thing, mm-hmm. maybe people having challenging experiences. I think this is why HPPD is something that demands attention, really.
Yes, definitely. And maybe like as a place here to also, because we started at the beginning being like, yeah, it's not always negative. It gets diagnosed when it's negative, to recognize that although this is my perspective, you may or may not agree, although I'm now at a point where I'm like, oh yeah, people should know that this is a possibility, but should also know that it isn't necessarily going to mean that it's really distressing and negative and like it's fundamentally going to be a bad thing. It might end up being something that you experience as being very positive. For myself, I experience it as being very positive, but you don't really know in advance what that's going to be or how intense it's going to be. And also maybe perhaps having a sense in advance of being like, yeah, I'm prepared. I accept the risks and I'll move with them as they do. And you can do that because it's a risk, that by having that as a mindset before you go in, perhaps you'll minimize the chances of it happening. I don't know. I'm just throwing that out there, but at the very least, you'll already have sort of like internalized resources prepared to address it when it does come up. So you don't sort of like fall into that gap that we were talking about that ends up going to psychiatry and having to go through all sorts of professionals and get drugs thrown at you that nobody really knows that they work. And yeah.
Right. Yeah, absolutely. And, speaking about my own personal experience, and then I'll relate this to the HPPD community at large. So they have been associated with some distress, especially with the DPDR comorbidity, which I mentioned. But, generally, these changes don't bother me. It's been too long for them to be a source of distress in my own personal experience. And it's hard to know what is part of this complex set of changes. But I have noticed that there are certain ways in which perhaps my experience of music has been enhanced, especially with the sort of somatic component of HPPD, how you notice these surges of kind of electrical and buzzy feelings. That synergizes well with music for sure. I mean, I wonder if it's part of the same phenomenon as getting the chills, the ASMR reaction. And with the HPPD community at large, the HPPD subreddit is quite a dark place. It's where people go when they're distressed. It's often where people make their first initial posts in confusion. But it needs mentioning, an HPPD positivity subreddit. It's small, but it has some activity. And this was formed by people in the community who were kind of put off by just how negative and pathologizing the main subreddit was. And so they made this community for themselves to be like, hey, I don't mind these symptoms, and maybe they actually enhance my life. And if you go on the sort of like the main drug subreddit or the psychonaut subreddit, or just talk to everyday people, when they do have these persistent changes, it's not necessarily bothersome. Some people portray it as like a free trip. I've heard that. I've heard that a lot. It's not necessarily bad, but as you say, it's about kind of informed consent, if that's the right word, and just basic harm reduction, because some portion of people who get these changes are going to be distressed by them.
Mm-hmm. So I want to shift gears slightly, utilizing your mention of the HPPD subreddit as the reference point, because in preparation for this, because as I looked into it more and more, I realized more and more how little I actually know. And that I was like, oh, this feels like an important episode. I want to reach out to the community of people who are like in HPPD life, and are communicating with each other to be like, what questions do you have? And the questions were twofold. One of which was like, like something that you would like to know, or a question that's formed because it's something you feel other people should know about HPPD, like people who are listening who aren't already a part of the community. So I'd like to ask a couple of these questions. And interestingly enough, a number of them have already been addressed just as through the flow of the conversation. So just give me a second here if I can just suss through them. I'm going to find a couple to ask here. Okay, so one question I think you already spoke to, but I'll just ask it again, is that is there any medication or treatment for HPPD currently being researched? And the next part of that is like, when can we expect them?
In terms of pharmacological treatments, I'm not aware of any active research. I was just speaking today to one of my colleagues at the PRF, though, the Perception Restoration Foundation, and there is an active study on. He'll have to forgive me because I've forgotten the specific name of the treatment, but it's a particular. I'm hazy on the details. It was mentioned to me this morning, but it was basically a particular technique where you basically like do certain programmings with the way you move your eyes as a way of training the brain, I believe. But let's scratch that. I'm really hazy on the details. But ongoing studies. Well, I suppose that's a way to mention the Macquarie University study, which the PRF has raised funds for, which I believe is opening for recruitment now or very soon. And that will do the deepest ever neuroimaging scans of HPPD patients using 3 different kinds of scanners. including fMRI. So you can see how the HPPD patient's brain versus control evolves in real time. And the idea is, with this data, we can understand if there are certain neurotransmitters associated with the disorder. I mean, and as I've said, given how many different kinds of drugs are associated with it, it's clearly a very complicated set of neurophysiological changes. And if we can get some signal on the mechanism, then that is the bridge to some kind of treatment. And this won't be of interest to everyone in the community taking a pill. But if we can get as specific as possible on the particular neurotransmitters involved, then it's likely that any treatment will have fewer side effects, be more targeted. Yeah.
Great. This next question I think was kind of addressed, but I'll ask it again, which is, what do you know of cannabis specifically being a trigger for HPPD? Now, this is twofold, because I'm asking it twofold. I think I have a sense of the question, one of which is as the catalyst for development, and also as a catalyst for re-experiencing, because it seems like this question is around HPPD happening while they're on cannabis as well. So any information you have on the relationship between cannabis and HPPD?
Right. Yeah. So there's a lot of layers to be plumbed there. The first is that whilst LSD, as I mentioned before, was by far the leading kind of candidate for creating these changes, although we don't know if that's just because LSD happens also to be the most widely used psychedelic. Cannabis, there is evidence that cannabis can be an independent cause of it. And that speaks to, from my reading, it's a particular receptor, the CB1 receptor, which kind of is how the cannabinoid system can affect your visual cortex. So perhaps a particularly affecting cannabis experience or ongoing use changes the interaction of that receptor. But it seems to be not that common. But with more research, maybe we'll understand kind of the balance of the intensity of a single cannabis experience versus just persistent use. And because of the constraints of our samples, because of the constraints of samples that have been studied, it's hard to kind of separate the cannabis from the context of stress, related drug use. We just need better studies, really.
Yeah, more research. Yeah.
Right. But then other layers, when you're stoned, is HPPD amplified? I mean, it's hard to tell because, just speaking for myself, I've always had a certain psychedelic element to my cannabis experience. But the idea that cannabis can amplify the experience during the active time of the drug, certainly that makes sense, and it happens. But I think the more important question is, will smoking weed make my HPPD worse once I'm sober again? Some people say, yeah, my HPPD gets worse, sometimes like permanently, sometimes for a week, sometimes 2 weeks, sometimes a month. But speaking for myself, I have been able to continue smoking and enjoying cannabis with at varying frequencies since developing HPPD, all these changes, however you want to describe them, and it hasn't affected them. And I suppose to link to that, I think I'm something of an exception in the community, but I've been able to continue enjoying psychedelics, and they haven't increased the intensity of my condition. But it's important to mention that some people absolutely, in a very discreet way, if they trip again, something happens and it gets way worse, either permanently or just for some specific period of time. So it's a contested issue in the community. Should you continue using drugs? And for me, I've been able to profitably, others not. It's just complicated.
Yeah, the second part of this question, and its slight divergence, is and because I really relate to it, and you had kind of mentioned it when you said cannabis is always kind of psychedelic for you. The question is complemented with, the only time I get symptoms is with cannabis use, which makes it hard to distinguish between the effects of THC or the use of psychedelics. I guess what they're meaning is like insofar as what's causing or triggering their HPPD. But when I read it, one of the things that comes up for me is how much after taking psychedelics, especially after taking ayahuasca in particular, that cannabis has changed forever. And no matter what amount I have, it's now always psychedelic. And it feels like I'm on a psychedelic drug rather than maybe before I was just like, oh yeah, man, I just feel so relaxed. Ha ha ha. Life is so crazy. But now I'm like, okay, I'm tripping now. Yeah.
Yeah, I think a lot of people have that experience. And, I actually tried LSD before ever smoking cannabis.
Wow.
So it's kind of hard. Yeah, I went straight from being drunk twice or 3 times to just drop an acid. That was just the 17-year-old I was. But yeah, so I don't really have a comparison, but I think that a lot of people have that experience where cannabis is like permanently changed. And I do suspect there might be some relationship with like the general neurophysiological changes that are associated with HPPD. But for sure, I mean, having taken psychedelics before smoking weed, I definitely noticed that, my experiences were always more psychedelic than people I'd be smoking with who had never taken psychedelics. Like I'd be seeing kaleidoscopes on the floor when they'd just be like pleasantly enjoying watching Neil deGrasse Tyson. And that was it.
Yeah.
But I can't, I'm not an expert to speak on how it might relate to HPPD. But if this person isn't experiencing it in sober life, I wonder how useful the framework of believing I have HPPD is, especially since that kind of self-diagnosis can create the distress. That's the real problem.
Yeah, I think based on the question, I have the sense that they're inferring that they're experiencing it outside of normal life, but I don't know. So moving on, a couple more questions here. This one is interesting. I'm going to ask it. It's also a 2-part question. Is what is something you want everyone suffering from HPPD to know? Alternatively, something that every psychedelics user should understand about HPPD.
Oof. I think. Interesting question. So the first one, what should everyone with HPPD know?
Yeah, what is something that you want everyone suffering from HPPD to know?
I'd say I have 2 responses. The first is, as I've mentioned before, that the key to overcoming the distress and the key to lessening your visual changes, if they're distressing, if you want to do that, is acceptance. And there are all sorts of techniques you can do to train your ability to accept your present experience. Most common, meditation. Meditation's been very useful for me. The other one is that people care. Like it seems like you're going to be stigmatized if you come out, but my family are not endorsers of drug taking. A lot of my friends aren't endorsers of drug taking, but they don't judge me. They've accepted me. They know that I'm capable of being a functioning human being, and that even if I was rendered dysfunctional by these changes, that they wouldn't stigmatize me for it. And then from how I've discussed HCPD with yourself, members of the psychedelic community, people care. People don't want people they don't want people to be hurt anymore. Mm-hmm. People care. And the other part of the question was what should people in the psychedelic community?
What should every psychedelics user, something you want every psychedelic user to understand about HPPD?
That whilst it might be rare, whilst it might be complicated, whilst it might have causes that go beyond psychedelics, it's that the interaction of psychedelics and these changes is real, and that we need more research, and that an attitude of complacency is not helpful, if only because it makes people in the HCPD community feel minimized and sidelined, and it can increase the distress that's the real core problem with their condition at all. And that especially, even if HCPD is a very complicated condition, and that the way it's currently described in the diagnostic literature might change, capturing this intent in a sentence like HCPD isn't real, which I see quite a lot, is just from a communications perspective not useful, because it just lends itself to a feeling of minimization, and it creates the attitude, and it feeds into the culture of complacency where that detracts from the drive for research.
Mm-hmm. Mm-hmm. What you just said there at the end actually links into the next question. And what you said about, HPPD isn't real, like that's a problematic sort of inference to be putting into the culture. I feel the same way about bad trip. The shift was like, there's no such thing as bad trips, only challenging experiences. I did a whole series of talks on, like a whole series of the same talk on bad trips. And about how like, actually it makes more sense not for us to say bad trips aren't real, but to redefine what a bad trip means and recognize that if people are like, I had a terrifying experience and it was a bad trip, you'd be like, yeah, that does sound like a bad trip. How can we work with it in a way where it can turn out to have served you for the better in the long run, and at the very least no longer be negatively affecting your life, rather than being like, no, you just don't understand. It was challenging, which infers some sort of like incompetence or inadequacy or something along the lines of that. Maybe not in a professional who's like in a deep dynamic of caring and support, but as sort of like a general sort of cultural way of talking about the thing. I think it limits people's capacity to feel like they can speak up, which then causes more harm than good if people can't talk about their distressing experiences without fear of judgment or minimization or, even in some extreme cases, being ostracized.
Mm-hmm. Yeah, I completely agree. And I think that just from the outset, I mean, bad trip, it's not a perfect term, but having experienced the psychedelic panic, it feels like in that moment, there's no better way to describe it than this is a bad trip. But I mean, I just don't know how this language will evolve over time. We don't know what HPPD will be called. But yeah, I mean, language is important because it's part of the set and setting. Mm-hmm. It shapes people's experiences. There's a looping effect at play. Yeah,
that's
not
great.
sure what else to say. Yeah.
There's a lot we can unfold about language and meaning and how it informs mindset, but we'll save that because it's a different conversation. It's actually something I've been writing about quite a bit in a book that may one day be seen by the light of the world. So the question that I said linked into what you're saying here is this question, which is why people who don't have HPPD think it's not real.
Why people who have HPPD think it's not real? Well, I guess there is, I think there's probably three layers to this question, to the answer rather. One is that some people will think HPPD isn't real because there's a sense in which the current formulation that HPPD has, especially in the DSM-5, is inconsistent. I mean, a core criterion of HPPD in the DSM is that it can't be attributed to other causes. But HPPD so often co-arises with DPDR, for example. But when you look at the DSM entry for DPDR, it says that DPDR may be associated with visual changes. And so there's a literal contradiction in the DSM. The fact that it's not just that, it's that the DSM describes it as a re-experiencing of phenomena that they experience when they're on hallucinogens, but these aren't just these aren't just the things that you experience tripping. They're like visual snow and halos, which aren't necessarily that psychedelic. The fact that it's independently linked to experiences that you can never get with drugs. So the first layer is that people say HPPD isn't real in the narrow literal sense that HPPD is a problematic diagnosis that research has recommended is probably changed. Mm-hmm. And I would actually probably tend to agree. But I think that just in order to, but then this needs to be tempered with the attitude of that I've kind of sought to emphasize throughout the podcast, which is nevertheless, these changes are real, linked to drugs, deserve research. Mm-hmm. Right. Number two, I think there's probably a sense in which people are, we kind of alluded to this earlier, which is that people who take psychedelics, they want psychedelics to have a good image. And so the idea that they can create this distressing set of changes that can lead on the extremes to end their own lives, that doesn't make psychedelics look good. And people who take psychedelics are already on the defensive against society at large. I mean, even whether it's in the generally negative way, although decreasingly so, that psychedelics are portrayed in the media, or it's even just in the acquaintance and intimacy of their own family. I mean, it's unlikely that people's parents are going to be pro-tripping. Yeah. So they want to be advocates. They want to be almost like PR. They want to be good PR agents for their own psychedelic experience. And so it makes sense that people wouldn't want to talk about their downsides like that. So there's a kind of general psychological cultural tendency at play. And then throw in the sort of commercial end of the spectrum, which is that clinical psychedelic firms, they've sunk a lot of money, and many of these founders are deeply invested in the promise of psychedelics, and it looks real that this could be a paradigm shift in mental health treatment. And so it makes sense that they wouldn't want to talk about a downside like this, or potential downside like this. And then thirdly, I would kind of categorize this as like the less developed little brother of the first point, which is that, people will come up with all sorts of vaguely sounding scientific reasons why HPPD couldn't be real, or these changes aren't worth paying attention to, like, oh, it's just, you didn't test your drugs, bro, or, oh, it only happens when you abuse psychedelics, therefore it doesn't matter to most people. It's just, but then, we know that, we know of lots of people who have tested their psychedelics, tested their tabs, and it happened. People who have had this experience after only a microdose. I know of a case study. We know of people who have just taken one trip, and these changes have set in. So, I encountered this this little brother counter reaction to HPPD when I shared an article on the sort of Joe Rogan subreddit. I was expecting, Joe Rogan fans are going to be into psychedelics. They'll be into this kind of thing. But the reaction was, it was pretty negative across the board, accused of being a propagandist for the drug war, all this sorts of stuff. And it was a bit disappointing, to say the least. But I think that this kind of thing has to and will decline with time. I think there's a general counteraction towards responsibility going on right now.
Yeah, that last bit that you spoke to earlier, I said, in extreme circumstances, people will get ostracized for saying, like, I have this, I had a bad trip, or I have HPPD. And you're speaking to exactly that. You're like, oh, this is an important thing. Research, like, there's all this evidence that says, like, we should talk about this. But instead you got ostracized, essentially. And, whatever, you're a agent for the drug war and whatever else, and so that, I think, I'm glad that you spoke to that. I'm going to end into this final question here. And I think actually the entire podcast is an answer to this question. And I'm going to ask it because I think it would be a great way to sort of end off the interview, which is, it seems as though most people only discover the disorder after development. How can we create better awareness of HPPD?
How can we create better awareness of HPPD? Well, I think that on the one hand, you will have organic appearances such as this, where you're creating bottom-up awareness raising within the psychedelic community. I think that there's a case for more mass media awareness, although this is subtle because the mass media isn't often very good at capturing subtle questions like HPPD, which, as we've covered in the podcast, is a very complex phenomenon. I think there's a case for careful, subtle mass media attention. I mean, in Michael Pollan's book, he discusses HPPD, I believe, and in a pretty responsible, good way, which is nice. I think that there's room for sort of press releases and awareness raising to the psychiatric community, because, like, once people recognize they might have this disorder, many people, as I've said, will go on to seek help. But if the people they seek help from don't know what it is, that's a real problem. So you can kind of go supply side in that sense. And then, the PRF is one of the founders of the PRF is linked with this kind of psychedelic commercial clinical community. So his own personal networking and discussions amongst the kind of commercial end of the spectrum more broadly, I think that will be one of the biggest engines of change and awareness, because I mean, it's been extraordinary to see how the attitudes and legal treatment of psychedelics have changed since the money's got in, for what it's worth. And I think that when investors and when clinical firms notice that there's this risk and that it might derail whatever money they put in, that's when awareness will start to really accelerate, because it's a real issue that could, although I'm doubtful it will derail any kind of psychedelic renaissance, so to speak. But I think it's a real red flag, and if it threatens their investments, then it's something they want to pay attention to.
Yeah, I am hearing you, and also like this other sort of like reaction is coming up, which is specifically to just like how much profit interest is shifting the sort of like priorities of psychedelic culture, both like on the, institutionalizing end, and also on the sort of like what the culture seems to be focused on as being really important to talk about, or how to talk about things that I have an edge against, or I come up against an edge in myself around that happening right now. So just kind of speaking to that, because I went to respond to you and this thing was in the way, and I was like, But Ed, I really appreciate you being on the show. I really appreciate you reaching out. I feel much more informed than I was before. I appreciate that you helped reveal a whole field of ignorance I was holding, and hopefully helped, I think, penetrate it in myself, and as a consequence might maybe penetrate that into the culture. And I use ignorance in the literal sense of just like not knowing, rather than a pejorative sense of whatever. And for people listening who might want to know more about what you're doing, or more about how they can support this work that's happening around researching HPPD, or the 501c3, I think is the term that you're working with, what are all the contact links, URLs, and social stuff that people can reach out to you from here?
Awesome. Well, yeah, just say, James, I really appreciate you allowed me to come on. It's been a pleasure. To engage with the work of the Perception Restoration Foundation. It's a pretty simple URL. It's just perception.foundation. Hit enter and you'll come onto the website. And for any HPPD patients listening who are based, especially in Australia, you may be interested in the Macquarie study, which I believe, as I mentioned earlier, is either now or very imminently due to start recruiting patients for neuroimaging. There will be a Melbourne study due for release, which is developing a psychophysics tool to test whether you're at risk of developing HPPD, which we didn't have much time to go into, but maybe another time. But to kind of just read for anyone who wasn't particularly aware of what HPPD is, just check out maybe the FAQs on the Perception Restoration Foundation website, and answers a lot of sort of the core issues. And if you want to follow my work, I suppose the best way is to go on my Twitter, which is just at Ed Prideaux, my name. Pretty simple.
Can you spell your last name? Because it's not intuitive, I think.
Right. Yeah. Right. So my name, Ed, E-D, and then Prideaux. And my Twitter, I'll share my stuff. Yeah.
Great. Well, I'll make sure for the listeners that all of those links are also contained in the show notes to this episode at jameswjesso.com, where all the episodes can be found. Ed Prideaux, thank you so much again for being on the show.
All right. Thanks, James.
And cut. Okay, thank you so much for tuning into this episode of Adventures Through the Mind. If you enjoyed it, you can like it wherever you saw it, share it with a friend, and help spread it around. Usually the algorithms aren't exactly in our favor, so your word of mouth promotion and distribution of the show is deeply appreciated and really necessary for this podcast to get reach. So thank you so much for doing that. You can check out Ed's work on Twitter, or the work of the Perception Restoration Project. Links to that will be in the show notes of this episode at jameswjesso.com, episode 152. And if you'd like to support the show financially, Patreon, PayPal, or cryptocurrency, the shop, or by purchasing something through one of our affiliates, those are excellent ways to do so. You can find all of those options at jameswjesso.com/support or checking the links in the description to this episode. If you'd like to follow me, you can do so at jameswjesso.com. James W. Jesso, Jesso, on Facebook, Twitter, Instagram. Instagram's not too active. I wouldn't worry about it. But in particular, following up on the newsletter where I release a monthly digest revealing the things that have been posted since the last digest before. And it's a great way to stay in touch without having to rely on the algorithms of social media, which usually aren't in our favor. So again, thank you so much for tuning in, especially all the way to the end here, and I will see you on the next episode of Adventures Through the Mind. Take care.